Hi everybody, Dr. Kerry here. I'm a chiropractor in Kelowna. Today I'm going over some breathing exercises for the ribs and the lungs. Lately I've had a lot of patients coming in with breathing difficulty, whether ribs are out of place or they're just getting over a cold or a flu. And here's some good exercises to do, courtesy of Verywell Health. And so rib mobilizations, that's something we do in the clinic when we adjust the ribs and mobilize the ribs, similar to spinal joint mobilizations. Now, the reason we do that is the ribs are attached onto the spine. There's 12 ribs on each side. 2 of them are floating at the bottom, so they don't attach onto the sternum in the front. And so the rib cage is very susceptible to misalignment, especially if the spine's out of alignment. So they kind of go hand in hand. So doing rib mobilizations, very important in the clinic, as well as spinal joint mobilizations and adjustments to realign the area and improve the structure. And then the range of motion as well. Now, when we do adjustments to improve the range of motion, we want the patient to maintain the changes at home. So that way we can progress, like 2 steps forward, 1 step back as we go through a series of treatments. Just sitting with your arms on your lap and your legs crossed, breathing in and out, taking very deep intentional breaths will fill up the lungs, expand the rib cage, and be very good for the flexibility of the ribs. So that's something that I do recommend. And actually I have a specific type of breathing that I like, and that's called box breathing. And you can use this for rib mobilization, but you can also use it for anxiety too. So you want to exhale to a count of 4, hold your lungs empty for a 4 count, inhale to a count of 4, hold air in your lungs for a count of 4, and then exhale and begin the pattern anew. And so just you can sit and just focus on that, and that'll really help to calm your body as well as expand and contract the rib cage. Now, just going back to this chart here, that's a specific type of breathing exercise you can do, but you can do stretching too. Like if you stand and put your forearm on your thigh and then reach up overhead, that expands the rib cage here on the upside towards the ceiling. That's really good for the ribs here on her left side, on the patient's left. Lying on your stomach, you can do these exercises right here where you put your arms up over your head and then just breathe in and out, and that'll expand the rib cage right here. I would keep your feet on the ground. Don't lift your feet up, keep them on the ground, but lift the arms up overhead and just take some deep breaths, expanding the rib cage. Back to this one right here, make sure you do that on both sides, on the left and right side, because we want the rib cage to be symmetrical, have equal range of motion on both sides. So I would do this about 8 to 10 times on each side, the stretching exercise. I would do the breathing exercise for 5 to 10 minutes. That'll really calm down any anxiety you have, tension, and then it's going to help to expand and contract the rib cage as well, help with the flexibility of those joints between the ribs and the spine. And then I would do this 8 to 10 times as well, holding this for about 5 seconds each time. And I tell my patients to do exercises first thing in the morning and just before bed. So that's a good time to do these exercises. If you have any questions, please let me know when you come into the clinic. If you're not a patient of mine, we are accepting new patients. You can click on the link in the show notes. And if you're not in the Kelowna area, feel free to comment or DM, and I will help you to find a chiropractor in your area.